So what I'd like to explain today is a little anatomy course on the penis and how erections work, and then subsequently how they stop working. And this is something that I feel is very important to explain to all my male patients, because it's difficult to sort of understand the anatomy if you've never taken an anatomy course. So how do things work? In the flaccid state, we're looking at a sort of cutaway piece of the penis here. You have three important spaces to know. These two spaces here are called corpora cavernosum. It's just an anatomical term meaning these are blood lakes. They hold all the blood in your penis. This little space down here, that's the area that you pee through. That's your urethra. Okay, there are two important arteries here. These are the cavernosal arteries. These bring blood flow into the penis. These small little blue veins on the outside, these bring blood back to the heart. So when you're having an erection, what does that mean? That means that these arteries have dilated to a much larger size, and they're bringing a lot of blood flow in. You could think of them like a garden hose with a lot of perforations in them, because as the arteries come through the penis, they're letting blood fill these spaces and the penis expands. But this is a mechanical process. So as the penis expands, these veins collapse and the penis can store blood. And that's how erections work in most men. And as you're young and you have a very strong erection that doesn't go down, this is working properly. So now you can understand how the penis works. How does it stop working? So there's two things that can really happen, and sometimes they happen together. One is plaque can deposit within these arteries, either one artery or both arteries. This is very common in diabetics, patients with high cholesterol, metabolic syndrome, obesity. If these arteries fill with plaque, obviously you understand what's going to happen. Less velocity of blood comes into the penis, and the penis cannot get hard and rigid enough to have intercourse. What else can happen? These veins have to remain closed in the erectile state. If they don't close in the erectile state, blood will leak out. We call this venous leakage. Okay? These are the two types of anatomical abnormalities you can have in an organic erectile dysfunction state. Now, all of this is diagnosed with duplex ultrasonography that we do in our office. Lastly, sometimes you can have a combination of both. The arteries are not pumping enough blood flow in, and the veins are not collapsing, and so blood leaks out. And that's a combination of both.